Hi, ladies. I wanted to go over with you on how to code from a surgical report. This is not really something that you're going to do for the test, but you will need to know this information when you start coding in your job. So let's go over it just a little bit. This is an example that's in the back of your book in Chapter 7. The operation was a diagnostic arthroscopy. And if you read down through here, you'll see that the patient was taken to the OR, the scope was inserted, they found a tear, a bucket handle medial meniscus tear, and they used forceps and then they repaired it. They did some shaving also. And the scope was removed. Everything was found to be intact. The knee was flexed to make sure that it was working right, not catching. And then they took the scope out. Everything was inspected and looks good. All the instruments withdrawn and the wounds were closed. So let's go over some of the questions on how to code this, because you're going to do a CPT code, procedure code, a diagnostic code, and let's see if we can get this correct. Let's see if there's any modifiers that need to go along with it also. So the first question is, what was the primary procedure? And you can see it says diagnostic arthroscopy here. But once you read on down and you see where they actually found a tear and repaired it, that turns it to a surgical arthroscopy. So that would be what your main procedure is. So you would locate that term. And what kind of other questions might be asked to determine which term to use? I would look up surgical arthroscopy, not the diagnostic, because that's what this actually ended up being. So you can look up arthroscopy and then surgical, and should be able to find it. If you can also look at knee and try to find it that way also. There's many different ways you can look these up in the coding manuals. But for a CPT code, you want to know what was the procedure. So the procedure was a surgical arthroscopy, and that's what I would look up. Something else that could be asked for as you're looking under a surgical arthroscopy would talk about transplants or autografts. Was there any type of infection? Did they have to do shaving? Did they have a lateral release? If so, which compartments? That information you're going to need to know too. And it talks about that in here, that the, let's see, medial compartment was normal. They did some meniscal shaving. Let's see what else is on here. Looks like the other compartments were found to be just fine, so you didn't need to look at that. So based on what the documentation that you're giving, the code for that would be 29881, and that would be your CPT code, your diagnostic code, or excuse me, procedure code. So now we want to look at the diagnostic coding, and based on that report, what is the preoperative diagnosis? And the preoperative was a possible torn medial meniscus. That's what they were looking for, to see if there were any problems there. Is the preoperative diagnosis the same or different from the postoperative? No, it was the same. Okay, so they had a bucket handle tear of the medial meniscus, and that's pretty much the same thing. It's just more detailed. So does the diagnosis support the post-op diagnosis? Is it supported in this? And yes, it is. Based on your choices, what question can be developed for this condition? You would probably look at your anatomical location. I'm sorry, I can't talk today. Based on the information in the tabular list, what do you need to determine? You need to know the episode of care. Is there any sign, symptom, or additional documentation? Yes, they talked about minimal erosion of the medial femoral condyle and the medial plateau. Is there any additional condition, sign, or symptom that was part of the primary condition? No. Does the additional condition require or affect patient care? No, it does not. And based on the documentation, what is your ICD-10 code? In this case, it would be S83.212A. Then we would need to take a look and see were any modifiers needed. Was the procedure performed differently than described by the code? No, it wasn't. Was the procedure performed on a site that had laterality? Yes. So we're going to look at that. This was on the left side, the LT. Was the procedure performed during a global period? No. Were there any additional procedures performed? No. Did the surgeon have help from another surgeon? No. Did a physician different from the surgeon perform pre or post-op? No. And what modifier then should be used? And the modifier should be the LT, since this was done on the left side, and this one does have laterality. So this is just an idea of how to read through these surgical reports and see if it makes a little more sense to you. Some people have a hard time pulling the information out of these surgical reports, and just read it carefully and make sure that when you're coding these reports that you are coding exactly what's on there. Don't make any assumptions. Don't add anything or take away anything if it's not documented. Always remember, if it's not documented, it wasn't done. So I hope this helps. If you have any questions, please let me know.